done faster, maybe. Good morning, everyone. I'd like to welcome you to our joint Senate and House Ag and Rural Affairs Committee meeting. First off, I'd like to give a shout out to some of the FFA leaders are here and some of the 4-H team people are here. So thank you for coming today and joining us for our hearing. Also, have a nice crowd of everybody else. Hopefully this hearing is very informative for everyone. I want to thank you all for being here. This is the 5th day of the farm show. Seems like it's been forever, but it's only the 5th day. And we're here today to discuss an important topic about farmer mental health. Today's meeting is co-hosted by the Ag Rural Affairs Committee meetings. We'll give a glimpse into the current and state of farmer mental health, what we can do to improve our outlook in the years to come. In addition to several of my legislative colleagues who introduce themselves here momentarily, we're joined by 5 testifiers who showcase some of the best Pennsylvania agriculture has to offer. We can't wait to hear from each of you. At this time, I'm going to ask Senator Judy Schwank to give some remarks. Senator Schwank.
Thank you, Senator Vogel, and good morning, everyone. I am so happy to see a full crowd here today to talk about this issue. It means it matters, and we've hit on something that's important to a lot of people. You know, this is a big issue for us in agriculture. We talk a lot about the economics of agriculture, the slim margins of profit, the climate, how crops are impacted. We talk about labor issues, so many things that, you know, a family that is focusing on agriculture production needs to think about no matter what you're producing. These are issues. But what we fail to talk about is how you cope with some of these different factors that are a part of farm life, and how the family and how the community actually reacts to these issues too. So I am very glad to see that these matters, you know, that are so often overlooked will be talked about today and brought to the forefront. Just earlier this week, I was at a conference, a national conference, where we talked about mental health quite a bit in agriculture. So I'm glad you're here. Again, glad to hear the testifiers. I see we have a great panel before us. And I personally want to thank my colleague on the committee, Senator Vogel, because it was Senator Vogel who brought this issue forward actually first. This is not our first hearing on rural mental health. So again, thank you, Elder.
Thank you, Judy. Senator Representative Paszynski for a couple more remarks.
Well, thank you very much, Senator. Thank you all for being here today. This subject is absolutely critical and certainly needs the attention that we're attempting to provide. You know, when we think about agriculture, you don't think about mental health. The discipline, the work ethic of a farmer and their families is incredible in order to produce the product with varying problems that occur, whether it's rain, snow, sleet, whether lack of fertilizer, et cetera, et cetera. And I think the average person has no concept of the kinds of pressures that the farmers deal with. Your testimony here today is vital for us in order to make that point clear to everyone and then find ways to help the situation so that, you know, we can approach this in a positive way, recognize it, and then find the solutions to help our farmers. Thank you.
Thank you. Representative Mao.
Thank you, and good morning, everyone. It's so nice to see not only FFA, 4-H is sitting in the room, a bunch of farmers, I assume, and also want to give a shout out to the Center for Rural PA, of which I'm a board member. Several of them are here today. So thank you all for being here. When it comes to wellness on the farm, I think I got the perfect solution. Just let's make farming profitable for all farmers. And I think that'll alleviate a lot of the stress on you. So with that, I'm anxious to hear what you have to say. Thank you.
Thank you, Representative Mao. Yes, profit will be helpful. Yes, it would. Anyway, I want to thank you. Like Senator Schwank said, this isn't the first hearing we've had. I had the first one, a roundtable with Secretary Redding back in 2018 maybe in Beaver County. We got some farmers and Farm Bureau people together and had a discussion and just realized how bad it was for some people. And the one thing that sticks out to me the most is one lady was there from Mercer County. And she said, the only time I see people is when I go to Sheets to get gas in my pickup truck. And that is just a very disheartening comment to hear from someone say they were on the farm 24 hours a day, 7 days a week. The only time I see anybody is when I go to Sheets to get gas in my pickup truck. And so anyhow, With that being said, we're going to move on. We have speakers here today, the Honorable Secretary of Agriculture Russell Redding, Dr. Florence B. Cotton, Nationwide Insurance, Early Career Professional and Agricultural Safety and Health, Dr. Ginger Fenton, Penn State Extension, Ms. Lisa Weary, representing the American Farm Bureau, State of Mind Campaign, and Mr. Jeff Cole, a Somerset County farmer and mental health advocate who wrote a song and became somewhat famous with it. So thank you, sir, for being here. At this time, we're going to give each our panelists 15 minutes to speak, and then we'll have questions afterwards. We have to be done by 10:30-ish, so everybody keep your watches and keep in mind. Thank you. Secretary Redding.
Mr. Chairman, thank you, and Chairwoman Schwank, and Chairman Pachinski, and Chairman Mao. Thank you. Honored to be here this morning, and thank you for taking on this topic. Right, it's a topic that reminds us we're human. Right, reminds us that there are a lot of pressures, some of which have been noted in the introduction, about just sort of the normal things that you inherit inside of the agricultural community. Right, the weather and things you expect, the market volatility you expect, farm transitions, all of that contributes to the stress. And what we've witnessed, particularly recently, is this sort of volatility has added a whole other layer and another dimension to that stress, right? And I feel it. I mean, I feel it in the voices, and I see it in the farms. And I think for all of us, just to be aware that we're asking a lot of this community. There's a reason we come together and celebrate it, and we're honored to do that. But I think behind every one of the folks you see in this complex, the folks in the fields, even to the agribusiness, I'll extend it, these are all folks who have everyday worries about how do you make this work, right? How do you meet these multiple and competing expectations that we have as consumers for the food system. And that comes at a cost. I mean, it comes at a lot of personal stress. So I think that awareness, I just want to thank you for elevating this issue, putting it at the front of the work that we do. I would also quickly say that I think the things that we have done together in terms of how do you assist the farms is part of the story, right? That they don't feel like they are alone. They've got a partner in the work that we're doing in the state. And we celebrate that on Public Officials Day here today, and we'll recognize that. I think that's a really important part. I want to know that somebody is there to listen, that they are there to help. I can't solve the problems necessarily, and I say I think it's the collective I. But knowing that somebody there is there to help is important. So thank you for the support of agriculture. I think the work we've done in the PA Farm Bill is a part of that. The work that we've done together to lessen the permit requirements is a part of that. The investments we've made to give folks sort of a long-term vision for where they are and where their families want to be is part of the story that we tell, and we wanted to honor certainly here during the week of Farm Show. So we've talked about a lot of the factors. I won't go through that, but I'll just highlight a couple of things to say that in the course of, since 2018, again, credit to Senator Vogel in the first sort of field hearing that we did. I'm with you. I mean, the testimonials sort of brought forth in a very clear way that there are folks who, as proud as they are, they're also, there's a social stigma to saying anything, and for goodness sake, don't ever express it to anybody, don't show the signs, and then it manifests itself in other problems. So I think we saw that very clearly. But as an administration, to note that we have been working on mental health access for farmers in rural communities through several things that aren't in the department, but the department is part of. I think this is important. The Behavioral Health Council, right, which is a cross-cut of the different agencies that have responsibilities. The Veterans Affairs Council has spent considerable time talking about stress, PSTD, and the related issues of stress for our veterans. We're part of that. The Suicide Prevention Task Force, the department's been part of that. To the point in 2018, we talked about what is the department doing or what can we do. At that point, it just happened to coincide with the federal farm bill was being passed, and there was a program that was entitled the Farm and Ranch Stress Assistance Network, and that was stood up with funding. Every state had to take some action to access it, and we did. We accessed that funding. It was an appropriation of $10 million. We partnered in Pennsylvania with the national network. And importantly, the nonprofit, it's a nonprofit entity that supports trained ag, health, and safety professionals. So we have a network of folks around the country that we can access 24/7 for farm families to call. Since that time, we've had at least 107 calls from farm families in Pennsylvania who've called the hotline, and they have received confidential service through that and referrals. That is important. We've partnered, as you know, at Ag Progress Days last year with the Centers of Excellence. And the Center for Dairy Excellence hosted a mental health and stress breakfast there, which is very nice to have that there and to have the partnership, of course, with our Centers of Excellence. We are hopeful in the federal reauthorization of the Farm Bill that the funding will be continued. But as we all know, the federal Farm Bill reauthorization has not occurred. We were with Congressman G.T. Thompson on Saturday, and there's a lot of the Farm Bill components that are in the H.R. 1, which is a separate topic. But there's some other reauthorizations of Farm Bill programs that still have to occur. We're hopeful, he's hopeful, that that happens here in early in 2026. We're hopeful inside of that the continuation of this farm and ranch stress assistance network is funded. In the meantime, we're not going to let the structure halt here in the state. We're putting $100,000 out of our PA Farm Bill into that. We feel like that was the purpose of the PA Farm Bill and noted earlier about the importance of that. So that's going to happen. We're going to continue that work, and we believe that that'll be done, by the way, in partnership with the PA Department of Health. Is partnering with us on the agri-stress helpline. In the coming year, we've also asked the department's Farm Safety and Occupational Health Advisory Board that we have to take on this topic of mental health and include this as one of their priorities. That'll be an important change. And then just sort of closing it out to say thank you. I mean, we're in this with some really, really wonderful partners. Penn State you'll hear from, and Posson, Farm Bureau, and the Grange, and the private health providers. I was at a Board of Trustees meeting several months ago at Penn State and really encouraged by the mobile Lion clinic. And the services being provided to rural communities through the mobile clinic. Really important, right? And it's one of those reminders to me about that's where folks are going to access health care generally, but certainly have access to mental health services as well. So these are all efforts that are part of the conversation that we're having. I understand well that you cannot have a healthy farm without healthy people. So today's conversation is about building on that work. Supporting farmer mental health is not separate from supporting agriculture. It's an essential part of sustaining our farms, our rural communities, and our food system. So we're committed to growing that nation we talk about and celebrate this week, but we do that in partnership with you. So thank you.
Thank you, Secretary Redding. This time, Dr. Bicott will speak.
Just turn your volume down.
Good morning. Chairman Moll, Pashinsky, Vogel, Chairwoman Schenk, and distinguished members of the committees. Thank you for the opportunity to testify in today's hearing, and thank you for focusing on mental health challenges impacting agricultural and rural communities. My name is Florence Bicott. I'm a rural sociologist, and I'm the Nationwide Insurance Early Career Professor in Agricultural Safety and Health in the Department of Agricultural and Biological Engineering at Penn State. I also have the privilege of leading the Penn State Agricultural Safety and Health Program, which is celebrating its 50th anniversary this year. As a statewide program, our goal is to reduce injuries, illnesses, and fatalities in agriculture. Mental health challenges in agriculture are a complex issue, and we've heard about this already, that requires care to understand and address. The written testimony that I submitted provides an in-depth, research-based explanation of what the problem is, what it matters, why it matters, and what we can do about it. My hope is that this written testimony can be a resource for the committee's work today and beyond. This morning, I will provide the highlights. My testimony is based on over a decade of peer-reviewed research and extension work to understand and support the safety, health, and economic viability of farm families. I have conducted research by the U.S. Department of Agriculture and by the Centers for Disease Control and Prevention. To understand the mental health challenges that farm families face, they're help-seeking strategies to address these challenges and the resources available to them. As a faculty member at the Land-Grant University and previously a scientist at Rural Hospital Research Institute, I am humbled and honored that thousands of farmers and their families across the country have entrusted my team and me with some of their most personal struggles. One of these farmers is Dwayne Martin. To frame my comments, I want to start with his story as it demonstrates the emotional and financial toll of farming. And I will say that earlier in a couple of days, I listened to Jeff's story and his song, and it was striking how similar their stories were. I first met Dwayne in early 2024 at a meeting that I was attending. I do not remember what the impetus was, but at some point, Dwayne started telling his story. By the time that Dwayne was done telling his story, there was barely a dry eye left in the room. Then, chatting with Dwayne afterwards, he talked about his incredible sense of guilt for being the last generation on the farm despite having worked so hard. He said that he had felt powerless in the face of forces outside of his control. Months later, out of the blue, Dwayne emailed me a 7-page account titled Sales Day and invited me to share his story whenever I had an opportunity. I am grateful for his trust, and I'm honoring it today by sharing a small part of his story with you. Dwayne wrote, "Every time I travel Route 8, I wonder how my cows felt that August 29th in the trailers taking them to Husky and Sale Barn. After the last trailer shut down and the truck pulled out, the end of an era. After 12 generations, no more Martin's milk cows. My family went from the entire family making 1,000 cows in 1931 to no one in 2021. I watched as the trailer pulled out. As they went, one of my cows, Payne, looked at me out of the trailer. It was not the normal look of her when she was caught being naughty. Instead, I will never forget the look of betrayal in her eyes. I went home that night and did not eat. I sat alone in the dark with my beagles, Otto and Buddy, at my side." Unfortunately, Dwayne's story is one that exemplifies the story that I've heard again and again over the years. While mental health challenges in agriculture are not new, the farm income crisis of the late 2010s, followed by the fallout from the COVID-19 pandemic, unprecedented consolidation in agricultural sectors, and the recent and sudden changes in our national policy landscape have increased awareness of the challenges that farmers and their families face. Many people and organizations have stepped up to take on the challenges supporting the mental health of the agricultural sector, and we're going to be hearing about those today, and we have already to some extent. But as crucial as it is, we're still falling short, and we need to expand our efforts. Beyond the personal tragedies, mental health challenges in agriculture raise concerns about who will produce the food, fuel, and fiber that we all need to thrive. They also raise questions of whether the difficult conditions that many experience in the agricultural endure should be expected of anyone carrying out this essential work. So what is the scope of the problem? Studies across the U.S. have documented high levels of mental health challenges among farmers. For example, an estimated 9 to 58% of surveyed individuals working in agriculture reported signs of depression. In Pennsylvania, a 2022 survey found that 42% of farmers and 53% of agricultural industry professionals reported 4 or more symptoms of stress. Agriculture experiences the 4th highest rate of suicide compared to all occupations. In Pennsylvania, 11 farmer suicides were documented by my program between 2020 and 2024. It is really important to note that this is likely an undercount because compelling data on suicide is extremely difficult, and I explain why in my written testimony. Finally, the progression to suicide in agriculture differs from the general population. It is more difficult to detect early signs of suicidal ideations and therefore to prevent suicide. So what explains mental health challenges? We've talked about these already, but they bear repeating. Similar to the general population, farmers and their families experience several layers of stressors. Some are connected to their private lives, some are connected to their professional lives. However, for farm families, and like any family businesses, their private and professional lives are deeply interconnected. Challenges impacting the farm operation often impact the farm household, and vice versa. Being part of a family business also means that it is more difficult to step away from work problems when they occur. Farm stressors are complex and multifactorial. Weather, commodity prices, regulations, concentrations in businesses along the supply chain, farmland pressure, heavy workloads, and strained farm finances. Constant uncertainty and risk of massive losses in a short amount of time are additional risk factors unique to agriculture. Farming primarily occurs in rural areas, which experience their own set of stressors due to reduced economic, educational, and cultural opportunities, limited broadband access, geographic isolation, and importantly, barriers to healthcare. When asked stressors that impact them the most, farmers most often list those connected to the stressors that impact their farm operation. This is not surprising, as all of these are directly connected to the fear of losing their farm and their livelihood, along with losing their identity and purpose in life. While they receive less attention in the media, farmers also bring up two challenges connected to their personal lives: relationship and physical health issues. Physical health issues are particularly important to discuss because they are deeply interconnected with mental health and financial well-being. Farmers' challenges vary by individual, household, and farm characteristics. They include, for example, age, gender, marital status, race and ethnicity, farm scale, and commodities produced. Often embedded in these factors are cultural norms about what can be done or cannot be done, what can be said or cannot be said. In my written testimony, I dive into variations related to age and gender because they provide two good examples of why these variations need to be considered when seeking to understand challenges faced and how to best respond to them. When it comes to what farmers do when they experience mental health challenges, research shows that they use a range of positive and negative coping strategies, more often relying on negative strategies. But something that is really important to talk about is that farmers are often portrayed as unwilling to seek help. While it will always be true for some folks, they will just not seek help. Research and on-the-ground experience tell a different story. Farmers and professionals who regularly work with them report that farmers are more willing than they are able to seek support, that they are more willing to connect with financial assistance for the farm, and least able to access healthcare. In addition, and this is really important, more than once, I have been in rooms when farmers push back on the idea that they need to, quote, work on themselves, or see a doctor. Often these farmers remind me that much of what drives their stress lies outside of their control and requires actions from policymakers. That'd be you. We need to not lose sight that farmers are resilient and accustomed to dealing with uncertainty. They are no strangers to problem solving as they work daily to address challenges related to machinery, livestock, crop, weather, paperwork, a lot of it, and managing people. As the recognition of mental health challenges has grown over the years, farm organizations, farm service providers, and government agencies have expanded efforts to support farmers. When we look at these responses at the national level, they tend to fall in three categories. The first category is connected to education and awareness. These are intended to explain what mental health challenges are and what to do about them. Education is also used as a conduit to reduce stigma. This work has been done by a wide range of actors, and we are hearing about some of these actors today. The second category is connected to improving improving access to care through a focus on making behavioral health care more accessible through crisis hotlines, more affordable through counseling voucher programs, and training for healthcare professionals to better understand agriculture. Most often, this work is being done through State Department of Agriculture and land-grant universities. The third category of efforts is related to addressing structural stressors. Programs that stabilize income or reduce economic strain for the farm business or the household likely play a key yet underappreciated role. Oftentimes, these programs are not designed to support the mental health of folks, but rather to meet other goals. So for the farm business, we're talking about programs such as commodity and income support, crop and livestock insurance, disaster relief, and mediation programs. For the farm household, these include health insurance, food assistance, income support, family support, and disability programs. It is interesting to note that as much as the structural nature of farm stressors have been established, Few programs in the country are specifically designed to support farm families' mental health and their financial well-being in tandem. There are two notable exceptions from our neighbors up north in New York, where businesses, consultants tag team with mental health professionals or social workers. The evidence on how well these programs are working is limited, but it gives us important insights. Evaluations of programs from the first two categories, so that's the category around education and improving access to care, tells us that shows mixed or modest effects of these interventions. Yet, research also shows that these programs tend to expand in times of crisis and then contract once the crisis is perceived to be over. Yet, mental health challenges in agriculture are chronic, not episodic. Furthermore, there will always be a crisis of some sort. Some affect a single farm family at a time, such as a barn fire, while others impact an entire area or community group at the same time, such as the highly pathogenic avian influenza affecting the poultry sector. The few studies on the third category of effects, those to tackle structural sectors, suggest positive, important impacts. In all of my research, I asked farmers and stakeholders what they would like decision makers like you to know and to do. Over and over again, these folks have said that policymakers need to prioritize solutions that address the root causes of their challenges. So let's talk about what we can do in Pennsylvania to support our agricultural communities. Supporting mental health requires addressing rural healthcare provider shortages and making counseling financially accessible. It also means placing behavioral health specialists alongside the farm service professionals farmers already trust. It also means ensuring stable funding for a well-publicized crisis hotline and training for healthcare providers so that they can more effectively care for the agricultural sector. But addressing mental health challenges also requires us to reduce the structural stressors built into farm life. Farmers need fair and stable markets. They need reliable processing capacity and disaster relief and commodity programs that are easy to navigate. They need labor backup when illness or injury strikes, support for business development and farm transitions, investments in health and safety, and strong technical assistance for all aspects of the farm business. But let's not forget that almost behind every farm enterprise in Pennsylvania, there is a family. Families need affordable, comprehensive health insurance. They need support so that they can care for their family members along the life course, maybe childcare, disability care, elder care, or family and medical leave options. And they need broadband internet that supports telehealth and the daily demands of running both a business and a home. I provide more details in my written testimony, including specific examples of existing programs and policies from around the country and even other countries. There's no need to reinvent the wheel when we have wheels that work well. I recognize that this list of recommendations is extensive. Mental health challenges in agriculture are complex, and as such, a comprehensive response is both justified and necessary. As I was recently reminded, an elephant is eaten one bite at a time. My goal was therefore to provide a roadmap to help the General Assembly face the work in a realistic, coordinated manner across legislative committees, state agencies, and external partners. To support this process, the state could convene a collaborative action planning workshop to assess the feasibility and acceptability of these strategies among stakeholders, identify missing or underdeveloped strategies, and prioritize a sequence of action with the greatest impact for our state's agricultural communities. I'm happy to talk later about what that could look like. But above all, Pennsylvania needs a well-funded, long-term, and stable approach to farmers' mental health challenges, one that avoids the cycle of rapid expansion and crisis, followed by retrenchment once those crises are perceived to be over, one that tackles the symptoms and their root causes. The issues that we're talking about today are not abstract. They shape the daily lives, identities, and futures of farm families. Dwayne's story is a powerful reminder because it illustrates that support systems are crucial when farmers face difficult times, and that structured solutions are necessary for the agricultural sector to be viable and continue feeding, fueling, and clothing the state and the nation. Thank you again for holding this today's hearing and inviting me to participate.
Thank you. Dr. Fenton, you may proceed.
Chairpersons and distinguished committee members, on behalf of Penn State Extension and the College of Agricultural Sciences at Penn State University, I want to thank you for your continued attention to and concern regarding the mental health of our agricultural community in Pennsylvania. I'm an educator with the Penn State Extension Dairy Team and the co-lead of the Extension Farm Stress Team. My work in Extension began more than 25 years ago in food safety, which fueled an interest in pre-harvest food safety and then occupational health and safety for dairy farmers. Our farm, because I am a farmer, belonged to my grandparents and was formerly a dairy. We now raise corn, soybeans, and finish some market hogs. I would like to follow Dr. Becott's overview of mental health and well-being of Pennsylvania's agricultural community by sharing some of the ways in which Penn State Extension has responded and will continue to support our agricultural community. Penn State Extension is uniquely positioned to reach across all aspects of agricultural production in Pennsylvania. Therefore, our response to farm stress and approach to farmer well-being should also be encompassing and broad. Most of our efforts to support the mental health of our agricultural communities are facilitated through the Penn State Extension Farm Stress Team. This team evolved from efforts that began in 2017 when some dairy team members and the Center for Dairy Excellence were noting that we were having more and more conversations with farmers who just needed someone to listen to them. We observed an increase in concern about the loss of milk markets and a sustained decline in prices. As of today, our team is comprised of 15 members, which includes extension educators from 3 units and faculty. These team members bring a range of expertise, including agricultural safety and health, field and forage crops, dairy, and family well-being, along with a substantial network of connections within the agricultural sector across the state. Several farm stress team members are also part of the Northeast Farm and Ranch Stress Assistance Network, or FARSAN, which you heard mentioned earlier. The cohort is referred to as Cultivimos. It has been an important avenue for learning about the work of other extension colleagues across the region and for collaborating on common initiatives, including professional development opportunities. Besides some small grants to fund events and initiatives, the nature of farm stress team programming does not readily lend itself to cost recovery. This is a group of committing and caring individuals, and I'm proud to say that our efforts have been recognized nationally by several professional association awards and internally by Penn State Extension. The resources provided by Penn State Extension aim to support the agricultural community as a whole. Therefore, they target farmers and those connected to agriculture, including service providers and agencies locally, statewide, and beyond. In particular, we provide education about mental health challenges in agriculture, including strategies for coping with them and additional resources available for support. We often do this work in collaboration with outside partners. In addition to what we see in the media, research has demonstrated that farm stress is on the minds of our agricultural community. I was involved in a 2022 survey of Pennsylvania livestock producers and the supporting industry professionals. Of those who responded to the survey, 89% of the farmers and 90% of the agricultural industry professionals felt that mental health was moderately or very important. Mental health was indicated as a serious issue in the farming community by 72% of the agricultural industry professionals who responded. Now I will provide an overview of our key programs and resources. We know farmers can have demanding schedules and long hours. So one medium we have been using to reach them on their terms is a podcast. This format affords anonymity and convenience. The Farm Stress Real Talk podcast launched in May of 2023, and it aims to provide practical information in digestible 15 to 20-minute segments. We have released 30 episodes, tackling topics including family dynamics surrounding farm succession, farm safety, weather and climate-related stress, and ambiguous loss. Over 1,000 downloads represent 6 continents and 42 states in addition to Pennsylvania, which makes up about a third of our downloads. The podcast was recognized as a resource by the Great Plains Center for Agricultural Health and featured in several popular press publications for agriculture. I would also like to note and thank Jeff for being a guest on our podcast. Another program specifically targeting farmers is Mending the Stress Fence. This 30-minute program is offered as a webinar or in person to farm groups. In the program, we explore the dimensions of wellness, pose open-ended questions to foster discussion, and provide resources on suicide prevention. Over the past year, we have observed an uptick in the requests for this program, specifically for field and forage crop producers, as these producers are facing added pressure from export market uncertainty, high input costs, and fluctuations in commodity prices. Educators have been invited to present these stress management talks during crop days, no-till field days, agronomic professional conferences, conservation district meetings, to new and beginning farmers, and at other events. The educators have reported that farmers frequently approach them one-on-one after the presentation to talk to them or to request more information. Following a presentation, one educator shared that she was approached by a plain sect farmer who told her about his son's mental health struggles. Following a presentation at a crop and planting clinic in a northern tier county, the presenter received this email message from the organizer. Your presentation really seemed to resonate with many of the farmers in the room. Maybe this was due to the recent flooding, but either way it was well received. I think all but maybe one of the folks in attendance were unaware of the Agri-Stress Helpline and National Suicide Prevention Lifeline. I was surprised by this, and also by the number of people who provided positive feedback about your presentation and the topic in general. And I'd like to note we do informal audience polls at these meetings and have been surprised by the low number of attendees who are actually familiar with the 988 number. The Farm Stress team responded to this by creating a slide to be shared during our presentations by educators across extension teams. This slide features several of the helplines, including 988 and Agri-Stress and the Plain Sect helpline. Another effort is the Farm Stress wallet cards, and I have a stack if anybody would like one. They're here. We have distributed thousands of these cards through various ag events. In distributing the cards, I like to remind people to take one and put it in their wallets or put the number in their phones. Calls to these helplines can be made on behalf of other people. If you're in a situation and you aren't sure how to help that distressed person, the trained staff on the other line can provide assistance. The notion of being better prepared to help your friends and neighbors seems to resonate within the farm community. QPR stands for Question, Persuade, Refer. This is a nationally recognized suicide prevention program based on the principles of asking questions as to whether someone is having thoughts of suicide, persuading them to seek help, and referring them to somebody appropriate to provide help. Penn State Extension has developed a suicide prevention curriculum for the agricultural sector. This 90-minute program covers key points on how and why stress manifests in farmers, as well as a useful role-playing scenario that allows the participants to practice the concepts covered during instruction. The curriculum was submitted and is currently pending approval from the QPR Institute. And for those who seek more in-depth training on suicide prevention, several of our Farm Stress team members are trained to teach the 8-hour workshop Mental Health First Aid. The Farm Stress team recognized a continued need to equip professionals who serve the agricultural community and interact with farmers on a daily basis. Communicating with Farmers Under Stress is a 2-hour program delivered in person or online that provides guidance for those who support the agricultural industry to better equip themselves when they encounter farmers facing challenges. We cover the causes of stress, the signs and symptoms of stress, active listening skills, and resources for help. The workshop has been offered 23 times by extension educators to over 850 registrants, representing 43 states and several countries, including more recently Australia and Canada. Chip Flory, the host of AgriTalk Radio, featured the workshop on his national ag program. To list a few, Extension has collaborated with Horizon Farm Credit, the Pennsylvania Centers for Ag Excellence, and the Penn State College of Medicine in Hershey to reach our target audience. Conservation districts also have been extremely receptive to the training for their staff, as they expressed concerns about the added stress some farmers experience when implementing conservation programs. Our team recognized a need for continued professional development to enhance our skill set and preparedness. So in addition to educators, many extension employees are public-facing and interact with farmers and the agricultural industry. Therefore, we wanted to provide professional development to bolster their confidence and better equip ag industry leaders to recognize and respond to stress. The resulting webinar series was launched in 2022 and has covered 12 topics, such as delivering tough news with empathy, life after suicide, active listening skills, adolescent mental health, and the tensions of farm succession. These webinars are also open to the public. In March of 2025, the Pennsylvania Ag Forum, Taking Action Together for Our Agricultural Community, brought together stakeholders from across sectors who have an interest in addressing farm stress. The goal of the forum included building partnerships and implementing short-term collaborative projects identified through the strategic doing process. Over 50 stakeholders representing agriculture, healthcare, finance, mental health, childcare, academia, and government officials participated in the event. In addition to the networking opportunities, some outputs from the forum included an article on health insurance options for farmers, a webinar series on land use issues, a public service announcement on farm stress that has been broadcast by some Harrisburg area radio stations, and a grant-funded discussion group for farmers that features invited speakers and has even led to plans for a regional farm safety day. A follow-up survey after the forum indicated that 94% of the respondents listed specific actions they had taken as a result of attending, including fostering interactions with farm families, taking steps to realign their plan of work with mental health, and examining their organization's policies, procedures, or programs. The resource sharing that occurred was reported as valuable to the attendees as well. This forum was made possible through grant funding from the Northeast FARSAN. Given the encouraging results from the previous effort, another forum is planned for March 10th of 2026 in Lancaster. Our team's excited to see what collaborations and projects result from this effort. Additional information about the programs I referenced, as well as articles on farm stress and mental and financial well-being for farmers, is available on the Penn State Extension website at extension.psu.edu. I want to express my gratitude for a hearing on farmers' mental health. As we work with farmers daily in Extension, they frequently express concerns about low commodity prices, high input prices, the lack of reliable labor, succession planning, supporting multiple generations on the farm, among other issues. These are usually accompanied by the expression of feelings of helplessness as a recurring theme in the conversations. With that said, and similarly to our farmers, much of the work that we have been doing has been on a shoestring budget. Farm stress, like other safety and health programs, is often unable to generate revenue to cover costs and can be more challenging to attract farmers to when compared to production-oriented workshops. The Penn State Farm Stress Team plans to continue building our partnerships and collaborative networks to increase awareness and resources related to mental health for the agricultural community. Our team is meeting next week to plan future programs by examining the gaps in coverage and expertise, assessing stakeholder needs, and identifying emerging issues. We appreciate your continued support of these programs, focusing on the health and well-being of the agricultural community. Thank you.
Thank you. Ms. Weary, you may speak now.
Good morning. Chairman Vogel, Chairwoman Swank, Chairman Paskey, and Chairman Mao, and members of the committee. I'm thankful for this opportunity to present on this very important topic. My name is Lisa Weary, and I'm president of the Washington County Farm Bureau. And also we have roughly over 500 members, Farm Bureau members, and community members involved. I'm truly honored to talk to you about how mental health is important to the farming community. It's near and dear to my heart because I personally have suffered from extreme stress that the farm can put on you. I first started talking about mental health in 2018 because I learned from my own experiences that so many farmers do not want to accept it's okay not to be okay, and that's not okay. Being part of the Farm Bureau network, including American Farm Bureau and Pennsylvania Farm Bureau, has given me a number of opportunities to find support for myself and my farm, and in return I'm able to contribute ideas to the broader efforts I'll talk about today, which are helping farmers and farm families around the country. The history of the Farm State of Mind initiative, the American Farm Bureau Federation began working to address farmer mental health well-being in 2017, when we partnered with the National Farmers Union to facilitate a dialogue about mental health and deploy solutions across the farm country. That partnership became the Farm State of Mind initiative. 8 years later, it is going strong and remains a key priority for our organization. In 2026, we are entering a new chapter through the creation of Farm State of Mind Alliance. The Farm State of Mind Alliance represents a joining of forces with the Farm Family Wellness Alliance, which was initiated by Farm Foundation and the National 4-H Council in 2020. It will expand the reach of our collective messaging and resources to a broader coalition of food and farming sector partners, allowing for an even greater impact on rural communities. What the Farm State of Mind offers is, since inception of the Farm State of Mind initiative's goals have been twofold: to build awareness to reduce stigma, and to provide access to information and resources that promote farmer and rancher mental health wellness. Over time, through the Farm State of Mind initiative, we have carried out numerous campaigns to get people, including farmers, talking about mental health, to help anyone who is struggling understand that they are not alone, and to reduce the stigma that too often is a barrier to keeping farmers from seeking help before it's too late. This effort pervades all levels of Farm Bureau. Very importantly, our grassroots members have mobilized to make sure these messages are reaching into our farming communities. State and county farm bureaus, including Pennsylvania Farm Bureau, are actively engaged in outreach, communication at local events. For example, Pennsylvania Farm Bureau Women's Leadership Committee, when I was chair, we had been talking about mental health, well-being, and featuring this on our agenda for our topics at Farm Bureau Days. Also, I've traveled around the state and did various counties, not just Washington County, handing out stress balls and chocolate. We know that chocolate helps reduce stress too. Further, driving the conversation, we have been able to conduct research to better understand the dynamics of rural stress, farmer and rural perceptions of mental health, and substance misuse among rural adults. Importantly, Farm State of Mind makes available no-cost online counseling and consultation services on the Together All platform, which I have been very active in the Together All platform, which is completely anonymous, which is free to farmers and their farm families for members over the age of 16. This no-cost access is in addition to a national directory and the Farm State of Mind hotlines, which we can put together in partnerships with the University of Georgia to make it easier to find people to find help where they need it. Finally, in the partnership with Farm Credit and Michigan State University, we have deployed on-demand training for individuals who interact with farmers and ranchers, providing them with the skills to understand the sources of stress, identify effective communication strategies, reduce stigma related to mental health, and learn the warning signs of stress and suicide. More information about all this work and more, including tools to help someone in need can be found on the farmstateofmind.org. Having the leaders of the nation's two largest farmer professional organizations call attention to this issue in 2017 and commit their resources toward solutions, I believe was an important movement in elevating the conversation about rural mental health that we are still having today. I also believe that we have made strides in changing the conversations and encouraging farmers to reach out for help when they need it. Sadly, as we in this room know, and as evidenced by the fact that this hearing is taking place, that we need for this kind of effort remains. Multiple studies show that farmer suicide rates are 2 to 5 times higher than the national average. However, people are more than statistics. It is safe to say that most people involved in agriculture know at least one person who has struggled with mental health, and when one member of the family struggles with mental health, the whole family is deeply affected. While it's time that mental health challenges are unique to the young and the old, rural or urban farming is a stressful occupation that is associated with increased levels of anxiety and depression. Experiences such as natural disasters, extreme weather events, financial uncertainty, fluctuating markets, and other factors also contribute to extreme stress for farmers and ranchers who often live in a very isolated setting. What the Farm State of Mind initiative uniquely brings to the table, from my perspective, is that it was created by farmer organizations who have deep insights into the needs, lifestyles, and concerns of farm families. Just this past weekend at the American Farm Bureau President Zippy Duvall used the stage at our annual national convention to share a deeply moving and personal account of his own struggles with mental health after losing his first wife, to illness. His story and his willingness to so openly share it is a powerful demonstration to our members that it's important to seek help and that farming community has their back. Two of our members, Steve Breeding of Delaware and Marshall Sewell of Florida, have also bravely shared their video testimonies of how mental health has impacted them and their families. We have been able to get these stories in front of the wider audiences through social media and the Ag Council partnership. Farmers in American rural communities look out for one another, and to me, that's what our Alliance and the Farm State of Mind initiative are all about. American farm organizations coming together and showing up for American farmers is potentially a life-changing way. I appreciate the committee inviting me to present on this panel and for drawing attention to the farmer mental health during the Pennsylvania Farm Show. To build a sustainable future for agriculture for our nation and our world, we must promote the well-being of our nation's farmers and ranchers. I hope that in addition to the policy discussion we will have, Pennsylvania's farmers will receive the message that it's okay not to be okay, and that you are not alone if you are struggling. I also encourage anyone who feels they need support or knows someone that's suspect to struggling from farm stress, visit thefarmstateofmind.org and make use of our resources. The services available are private and anonymous, and they have helped many farm families already. Thank you.
Thank you. Mr. Coral, you're next. Thank you.
Okay. Thank you, Chairman Vogel, committee members, my distinguished panelists, and the guest folks who are here. Thanks for having me. I really appreciate the opportunity. So I am not here as any kind of credentialed expert. I am here simply as someone who has lived through farm loss, experienced the mental and emotional toll firsthand, and who has since, because of a very bizarre twist of fate, has spent the last few years touring the country, listening to hundreds of farmers tell similar stories. Up until the spring of 2022, I was a fourth-generation dairy farmer, milking cows on my family farm in Somerset County. That spring of 2022, economic pressures finally just caught up to us, and I made the most difficult decision of my life, which was to shut down the dairy, which meant having to sell our beloved and beautiful Guernsey cows. Now, I thought I was ready for that, but on the day of the sale, I began to experience feelings and emotions that I had never felt before. When the last of the cows, my stubborn little Dolly, was finally loaded onto the trailer, and that trailer door slammed shut, well, reality began to set in. My life as a dairy farmer was over. And I'll echo something that one of the other speakers said. So when the cows were loaded onto the trailer and I said goodbye to the trucker, which, by the way, I was laughing and joking with the trucker and telling him tomorrow's the first day I'll be able to sleep in 20 years. Of course, inside, something totally different was happening. But when I made my way to the trailer, the scene was just heartbreaking, and that was that the cows, of course, were very agitated. They were bawling, but they were sticking their noses out through the cracks and openings in the trailer, in the slats there. You know, they wanted off of that damn trailer. They wanted back in their barn. And just as an effort to give them some kind of comfort, I just started reaching out and touching noses. But I also said to the cows, you know, I'm sorry. I'm sorry that it's come to this, and I'm sorry that somehow I couldn't have been better and figured out some way to keep this thing going. And when the truck pulled away from the barn that day, the best way I've been able to describe this is that it literally felt as though something had been ripped out of me. And I must have led a charmed life up until that point, because I honestly didn't know that you could experience so much physical pain from an emotional trauma. In the days and weeks that followed the sale, I was, in a word, heartbroken, and I spiraled down into a deep depression, filled with a lot of pain and anxiety. On a day I didn't think I could take the pain any longer, two things leaned against my bedroom wall: a loaded shotgun and my old guitar. Fortunately for me and my family, I chose the guitar. And as some of the other speakers echoed, sadly, many farmers in similar circumstances are making another choice, with the statistic that I often hear is that farmers are now 3.5 times more likely to die by suicide than the general public. And now for that bizarre twist of fate. So, as I mentioned earlier, I picked up the guitar on that fateful day, and I went down to the barn, and I just stared at that empty space. And I ended up writing a song, really just to get out all that pent-up pain and emotion that I was feeling. Little did I know on that day that that song, called Empty Barn, would soon go viral, resonating with tens of thousands of people all over the country and really all over the world, and of course, mostly farmers and rural folks. So that song, Empty Barn, opened the door for me to start a new career as an independent music artist, and then as a keynote speaker, and now as a farmer and a rural mental health advocate. When I got out on the road and started to do events, I soon found out that Empty Barn was about far more than just my story and my pain. There were many, many hundreds or thousands of people experiencing similar loss. And somehow, this song that I really just wrote for myself that was really my cry for help kind of became a way for them to be able to say, hey, we've experienced something similar. And I cannot tell you how many times I've done shows or spoken at events that people will talk to me afterwards and want to tell me, their story, often with tears streaming down their face. And if I can testify to anything today, it's that there's a lot of pain out there, man. I have to say, this is a really strange setting for me. I've never done this before. Usually my audiences, there's beer or something involved, so speaking to a bunch of stone cold sober people, yeah, really has me a little freaked out. So I have a bunch of other remarks here, but can I just tell you a story that maybe sums this whole thing up? So when my story broke, I got a lot of national press, and I started to get invited to come around and perform and do things. And out of the blue, one day, someone called and asked me to come do a speaking engagement. And I honestly said to the person, she asked me to come speak on mental health. And I said, you have the wrong guy. I'm not a speaker, and I don't have anything to do with mental health. And the lady laughed, and she said, no, I've been following your story from the beginning. Your story has everything to do with mental health. All you have to do is come and tell your story. So I asked her if I could bring my guitar, which I sure wish I had right now. So she thought that was a great idea, and that gave birth to me doing this thing I call a keynote concert. So I get up and do a talk with the guitar and just kind of tell my story. So the story I want to tell you is one of the very first speaking engagements I did for the National Farmers Organization out in Coralville, Iowa. I was doing my thing and telling my story, and I tell, kind of my story to set up when I'm going to perform Empty Barn. And most of the folks in the audience were dressed kind of like you guys here, a little bit formal, jackets on. But there was one guy right down close, big guy, who had on bib overalls and a baseball hat. And he was probably a guy in his mid-30s. And a reporter one time described me as a man with an epic beard. This guy had an even more epic beard than me. But at any rate, when I told the story, I kind of was glancing around the audience, and I noticed that this guy looked like maybe he was getting a little emotional. And when I sang Empty Barn, sure enough, he became emotional, and I saw him wiping away a few tears. Afterwards, I was at my table, and by the way, on that Penn State podcast, I learned that tabling is a verb. I didn't know that. So she said to me, oh, you were tabling. I said, I was just at a table, yeah. So at any rate, I was tabling, and this fellow was in line to wait and talk to me, and when he came his turn, I recognized him as the guy who had gotten a little emotional. So I stood up from behind the table to shake his hand. And I'm 6'2", and this guy was a good bit taller than me. And when I went to shake his hand, he just grabbed me and pulled me into a bear hug and bent backwards so that he lifted me off the ground. And when he did that, I was wearing this hat, and the hat went flying off. And while he was lifting me, he was saying, that was the greatest effing song ever. Except, excuse me, he did say the word. So, put me down, lifted me up again. That was the greatest effing song ever. And by this time, he had squeezed all of the air out of me. And I think other people there were about to intervene. When he finally set me down, and I looked at the guy, and I said, hey, wow. What's going on? And he told me a story that, it just broke my heart and is very relevant to what we're talking about here today. And that is that he had grown up on a dairy farm in Wisconsin. And when he was a senior in high school, his parents made the decision to shut down the dairy and sell the cows. And as he told the story, his parents were older. He was the last of the children, and his dad was really having a hard time with it. And so he decided that he had to be the one who was going to be strong for the family. And also, I should say, he also told me that day that the whole dream of his life was to take over the farm. And so he didn't want to, tell that to his parents or whatever. He just knew that that was it. And so he stepped up and actually was the one who helped with making the sale arrangements and everything. And just like me, the day of the sale, man, he had on a happy face, and boy, I can't wait to see these cows go down the road, and whatever. But inside, he was torn up and heartbroken, and he never told anyone how much that had affected him. And when he came to that event in Coralville that day, he had no idea who I was. He had never heard my song, Empty Barn. But when he heard my story and heard the song, what he told me that day was that wherever he had walled off that emotion, that wall came down, and that was the first day he had ever allowed himself to grieve over his loss. And I'm telling you that because I think there's a little bit of an element here that I think all the programs that everyone is doing are fantastic and they're absolutely needed. But there's also an element of farmer to farmer. And when a guy like that or other guys see somebody that looks like me or somebody that looks like them, it tends to, and I get up on the stage and I tell my story. And then I also act like a goofball and we sing a bunch of happy songs and do stuff. But, when they can see someone like them modeling this idea that, hey, this guy's vulnerable. Hey, he told his story. Hey, he wrote a song about his story. I think a little bit something happens that it opens them up more. So I would encourage everybody who's in, a better place mentally, which, okay, maybe is none of us, but at least some days we're okay. When you see one of your neighbors or your friends struggling, don't just say, hey, how's it going? Because every time you say, hey, how's it going, the stock answer is, hey, great, it's fantastic. What someone did for me in that time frame of when I was selling my cows after the sale was to put his hand on my shoulder, look me in the eye, and say, I honestly want to know, how are you doing? And if you're not okay, what did you just say a minute ago? Are you okay? Yeah. Are you okay? It's okay, by the way, to not be okay. And if you're not okay, let's talk about it. So if there's anything, I don't know that we can solve the economic problems today, but if there's anything we can do for our fellow farmers, it's to be there and encourage this thing. We need a language. We need a way that guys that look like me can feel okay to say they're not okay. I really like that. So I'll just conclude here by, I want to tell you all something, which is that by the way, I'm also just embarking on a partnership with a wonderful organization called Rural Minds, which was started by Jeff Winton, who has his own tragic story, dairy farm family in New York. His nephew, who was an integral part of the farm, committed suicide out of the blue. They had no idea that there was anything bothering him. And he started this wonderful organization called Rural Minds. But I am going to be doing a national tour midsummer through fall, to where we are going to go across the country playing exclusively on farms in barns. It's called the Barnstorming Tour of America. And the whole point of the tour is to raise money and awareness for farmer mental health initiatives. And I'm telling you this because we are just very much in the beginning phases of planning and organizing. So if anybody wants to give me their 2 cents on how we can make that as good as we possibly can, I'm all for listening. The other thing is we are doing this totally grassroots. We want to play on farms. So we need farm hosts to host the concerts here in Pennsylvania and across the country. So if anybody wants to be a farm host, I've done many barn concerts. They are a wonderful, wonderful thing. Rural Minds is going to be involved with that. And the other part of that is we are going to encourage high school age kids through 4-H and Future Farmers of America to write a poem and or an essay as to how mental health has affected them, their friends, or their community. And we're going to have those kids getting up and doing their poem or their essay live at our shows. So if anybody wants to talk to me afterwards about that, I'm happy to talk. But thank you all very much. I appreciate you.
Thank you, Mr. Corres. Very touching. I can sit here and almost cry myself because I know the day my mother sold the cows, my dad died. Like you said, when you put them on a trailer, it's life-changing, very much so. At this time, Senator Swank for some questions.
Thank you, Senator Vogel. And first thing I have to say is what took us so long to finally understand and to really take this to heart, how all of the factors that face farming families, how impactful they are. And they have long roots. They may go back several generations and go forward because, as some of you said, it impacts the family as well. As a former farm wife myself, I can tell you that it impacts the children and family as well. So I feel very heartened, and I want to thank all of our presenters. You did an amazing job of bringing this issue to the forefront for us. And you know what, it's kind of specific. As I said, I've talked to farmers from the Midwest and Western U.S., and they have different stressors maybe, but similar. And so the livestock issue, I think, here is something that came out that, the dairy farming, and it has it's a whole way of life. And so it's very different in terms of how you respond to it in terms of mental health. One thing that I would ask you, though, is do you touch on, when you talk to individuals, domestic violence as well as the issue of child care and farm safety? One of the things that I look at quite carefully when I read the Lancaster Farming or other news, farm accidents, and they're often children, young children, that maybe if they're, you just can't leave kids in the house, but having them run around outside exposes them to different dangers and issues that they might face. Was that something that has come up in some of your discussions? And I'll add substance abuse, because I don't think we're immune from that either in terms, the farming community, in terms of being exposed to that. Any thoughts?
Thank you, Senator Schenck, for that question. The issue of domestic violence is one that I've talked with several folks over the past few months here in the state and internationally. When we look at the research, there is hardly any research that looks at domestic violence in agriculture in the context of mental health challenges. And it is something that I've looked at myself because of my work on childcare and my work with farm women on stress. The only study or article that I could find in a journal was from Canada from the 1980s. However, we know that when there are financial crises, we know that there are often domestic issues. The issue of children's safety is one that I work on a lot in my role, and work a lot on it with the colleagues at PDA. And last year we had conversations as well with the Pennsylvania Department of Family Services, and there was another service involved. And we did touch a little bit on the issue of domestic violence. What can we do about it? I will tell you, it is daunting. How do we approach that topic? It is deeply personal. There's a lot of shame around it. And how do we approach it in a way that is respectful and also does not put victims in more dangers if they bring up the issue. We know that in rural areas, it can be, one of the reasons why it's difficult to escape a domestic violence is that often you have nowhere else to go. And so in rural areas, it is even harder. It can be harder as there are less shelters for folks who suffer from domestic violence.
Senator Schwank, on the substance abuse, it is covered in the farmstateofmind.org. We know that is a concern too, so we have that, so people can go in there and get the help with the substance abuse also. It's available.
I would add that it's also part of the Communicating with Farmers Under Stress. We touched briefly on it, probably not as much as we should, not more substance abuse than domestic violence. There is a team within Penn State Extension that works more with those issues, that has some overlap with the farm stress team, but we certainly opportunity to collaborate more. Thank
Well,
you.
we're getting started here, right? And you're doing a lot, so I commend you for what you're doing. But I think, too, as we evolve, these are things that we need to talk about. And Secretary Redding just left, but one of the things, I had the opportunity to talk to Dr. Peacock before, that we need to find a way in our farm bill to also fund this even more extensively and touch on the farm safety issues as well, because that's something that we had in the past that we're not focusing on. It's not just suicide that agriculture is leading in, unfortunately. It's also in farm accidents. And Jeff, you stole the show, but your point about farmer-to-farmer conversation, I think, is one that somewhat eluded me, but I think you're absolutely on target. Thank you for what you're doing. Thank you, Senator Vogel.
Representative Pashinsky.
Thank you very much. I truly appreciate, we all do appreciate the good work that you've been doing, and then also adding to this incredible situation, the idea of music. Amazing how the message can be told and the kind of emotion that's created. Senator, I think whenever we have these kinds of issues, we should definitely have chocolate for everybody.
I'm with you.
So let's make sure we have chocolate for everybody next time. For those of you that came in late, chocolate relieves the pressure. And but as legislators, how can we work together? What do we need to do in order to address this issue? You've done incredible research, and you have tremendous amount of facts and experiences. How can we, as government officials, what can we do? And I'm not suggesting that you may have all the answers, but oh, there it is.
You deserve that.
There it is.
Right there.
Representative, it's my job.
Well, you interrupted one of the. I always ask this question, and those of the members of my committee know, and I mean this, but very sincerely and honestly. If you had the power and the resources, what do you think is the solution? And then that may help all of us come together and develop that solution. So, Doctor, it's all yours.
Thank you, Representative Paskey. I actually often ask that question. If you had a magic wand, what would you do? I would take my magic wand to address concentration and consolidation in agriculture. Concentration and consolidation, it's for those of you who are not familiar with that term, it is the idea that over the years we have had a reduction of input suppliers as well as retailers, as there's been more concentration in the input system, more concentration in retailers. So as farmer, you used to have a lot more options when you would want to buy your seeds or when you would want to sell your milk. And then over the years, for a lot of reasons, it has contracted. I highly recommend that you spoke to folks in Missouri, Mary Hendrickson and Phil Mount in Michigan. They are internationally recognized folks who have studied the issue of concentration and consolidation and why that hurt farmers. Essentially, when you don't have a lot of choice in terms of where you buy your input from, and when you don't really have much choice where you sell your production to, it's particularly the case in some sectors such as poultry, hog production, but also dairy. A few years ago, we had our farmers in the Northeast, as well as in the Midwest where I used to live, who received a letter that said, starting next month, we will no longer take your milk. Folks were scrambling and could not find other places to sell their milk. So that's where I would start. Of course, it's a really big one. I understand too that in your role as state legislators, there are things that you can do, and there are things that you cannot do because they're not in your purview. They're the purview of the federal government. But as you have the ears of your colleagues, the federal legislators, talk to them about this. Remind them. There has been work that was started, in particular in the context of COVID-19. COVID made it really clear why and how concentration and consolidation impacts our ability to feed people. In terms of solutions, in the written testimony, and as I was writing my testimony, I was thinking, they're going to think that I think they can do everything, and that I think they're a Santa Claus. I don't think that at all, but I took it as my opportunity to outline a wide range of solutions. So there are pages 8, 9, and 10 of my written testimony. It's interesting because when my spouse asked me this year what I wanted for Christmas or last year, I don't have any ideas, but today I did. But in all seriousness, we've talked a lot about programs and resources to address mental health challenges. They are absolutely crucial, but I want us to spend as much time talking about the structural stressors that impact farmers. And I also want to think about how, what my research is showing too, in the work that I've been doing with my excellent colleagues, is that there are potentially productive unintended consequences of kind of telling farmers you have to work on yourself, and then not calling out the fact that a lot of instances there is, and I think Jeff, your story tells it, they work so hard and yet they failed. And so as much as those programs are important, how do we remind folks that it wasn't their fault, and how do they talk with policymakers to talk about what needs doing? Because, Senator Schenck, you talked about why we're just hearing about this. I've been working on this for over 10 years. There's 40 years of research that point to that issue. So I'm glad we're talking about it, but we have a lot of catching up to do.
I'd like to add to that. We're asking that maybe we can get more partnerships with the Farm State of Mind in this alliance, due to it has free counseling. The farmer can go on there and talk to somebody, a professional, and it's totally free. And for us to be able to have this free for the farmers, it's for all these partnerships that are helping us out with this alliance. So this is something that could really help us out as you continue to talk about the farmers' mental health. This would really help us out.
Do you have an idea of the cost?
No, I don't. Not exactly, no.
Okay.
But I could put you in contact with someone that does.
Because it always comes down to that. And with all honesty, there's always more demand than we have resources. So it's important that we know, what kind of cost it will be.
Yes.
Thank you.
Senator Yaw.
Thank you, Mr. Chairman. A couple of comments. I have ag breakfasts, a couple of ag breakfasts in my district every year, which are specifically oriented towards farmers. And about 4 years ago, we had a breakfast and we had a panel from Penn State Extension to talk about mental health. And when I saw the agenda, I thought, this is not going to go over well. It's just not going to fit. And much to my surprise, it was one of the more popular things that we've ever done at one of those ag breakfasts. So I think that, a hearing like this, where we just talk about it, it was really accepted. And I think virtually every ag breakfast I've had since then, we talk about mental health in the rural community. And it's been very, very successful. So doing something like this just brings it to the forefront. One of the things that we face here in Pennsylvania is this. 73% of our population lives in 19 counties. That means 27% of the population lives in 48 counties. Those 48 counties is rural Pennsylvania. And it's already been mentioned, Representative Mao mentioned about the Center for Rural Pennsylvania. I happen to be fortunate enough to chair the Center for Rural Pennsylvania, and he said that there were many members here. Representative Mao is a member of that board. Representative Pruszynski is my vice chair. Senator Schwank is on that board, and Dr. Nancy Falvo is back here. She is on the board, as well as our executive director, Zachary Adams, is here. So rural health care is probably the number one issue that we face. And it's how do we, it's all the issues that you've talked about here today, but it's just women's health care is a major issue. It's all those things, and part of it is just the fact that I said is where the population is, and as legislators, I don't know how we deal with that. I guess Representative Pruszynski said it always comes down to money. Well, it does, and rural health care is a significant issue, and unfortunately, just because of the distances involved, it's a challenge. So I thank all of you for your participation, and just bringing it out to talk about this in public, I think, is a huge step forward. So thank you. Thank you, Mr. Chairman.
Thank you. Representative Mao.
Thank you, Mr. Chairman. In the interest of time, I will skip right to my quick little story and say what I have to say, and maybe you guys can fill in the blank. I grew up in two farms. One was a small dairy farm. They were side by side. Now, I was very young, so you got to understand where I'm coming from on this one. That wasn't sustainable. It was too small. And eventually, Dad had to sell the cows. They went. So we've experienced somewhat. Now, I was like Dorothy, skipping down the yellow brick road. Hey, no more carrying milk from the barn to the milk house. And, I didn't understand, but then the argument started in the house. And I saw how it affected my mom and dad. So thank God we had another farm, and that one we transitioned into grain. That's all we did. That became grain and storage in the barn. That was about it. We were lucky. We were one of the lucky ones. We transitioned, which brings me to my thought. And maybe Extension's already doing this. I don't know. But rather than just calling somebody to help you through your mental time that you're going through, because it's almost when you let go of your cows, and I saw how emotional you got, it's your pet dies, and you say, well, I'll get you another dog. I don't want another dog, I want that dog. Well, you can't have that dog anymore. That one's gone. But the other dog, when you do get it, cures the heart, okay? If you transition, even though it hurts to lose the cows, they become your pets. When you transition and you start making money, being successful with your transition, that helps cure that void in your heart. It helps get you through that. So my question is, through Extension, or is there another organization that when a small farmer, whatever he's doing, whether it's dairy or grain or beef cattle, whatever, when he needs to transition because financially it's dragging him down, okay? Is there an organization or through Extension that will literally send somebody to the farm, assess what he's got, maybe take soil samples, send them into Penn State, and say, this is how, if you transition to XYZ. In my area, a lot of people have gone from fruit over to grapes, which I guess is still a fruit, but wine's becoming a big thing. And they're now making money. Okay, that's kind of what I'm getting at. Is there somebody there that will literally assess a farm and say, if you transition to this, and now here's the help that helps you transition? Is that there?
I can start with that. There is a farm transition team through Extension. There's a program for new and beginning farmers, which doesn't necessarily mean they're new to farming, but new to that commodity. It's interesting you bring that up because there's still stress associated with people being new to farming. I met with the horticulture team last week, and several of them told me that their new vegetable growers have transitioned from dairy. And so they're in a whole new enterprise and trying to work through that. But yes, there are, and that's what we do. We, not necessarily me, but there are teams in Extension that will go out and do that. There are also, through the Centers for Ag Excellence, I know the Center for Dairy Excellence has dairy decision consultants that will help walk through those types of transitions as well.
That's good. I'm glad to know that they're there. They should probably be one of the numbers on that little card that you're handing out. Okay. Thank you, Mr. Chairman.
Could I add, Representative Maury, that there is also an organization, Pennsylvania FarmLink, that specifically works with older farmers to transition the farm. And I recently had a conversation with the executive director. I am on their advisory board. And what Darlene was saying is that, and as Ginger mentioned, those are really stressful periods of time. And she wishes that there was an opportunity to have behavioral health specialists or social workers working with them. And that's one of the examples that I gave from New York. Cornell University, many years ago, they were seeing that their farm business folks, their counselors were faced with farmers who were dealing with a lot of stress, and then they have teamed with behavioral health folks or social workers who themselves have a farm background to work in tandem. Ginger and I have talked about this before. We would love this program in Pennsylvania, and I know that we're not the only one.
Thank you so much.
Thank you. Senator Malone, sorry. Senator Malone.
It's all right. Happens a lot. So you'd mentioned that you get a lot more participation in the production-oriented workshops and field day. And just in an effort for normalization, has there been thought into redesigning those workshops to inject some of the most critical tools that are needed to be able to manage stress and to identify it yourself and to reach out for yourself and your others?
Yes, that has been a great collaboration across units and with other organizations. They have been extremely receptive to the Pennsylvania No-Till Alliance, for example, has been incorporating farm stress in their meetings. And we've tried, it's just like ag safety and health. It's very hard to get somebody to come just listen. They know how important it is, but they don't want to just come hear a workshop about ag safety. But just like you said, if it's one session or a breakout session at those workshops, people seem very receptive and listen to it. And yeah, we have been exploring that and reaching out more to other commodities. We typically work with livestock and crop producers. Just being aware, now I mentioned our vegetable and horticulture, our green industry, just across all sectors of agriculture, I think there's opportunity for those interjections of farm stress and well-being.
Representative Cook.
Thank you, Mr. Chairman. From the 50th District Green in Washington County, Jeff, we're going to adopt you today as part of this hearing. We appreciate it. Southwestern Pennsylvania is about as far west and south in the Commonwealth as we go. The one thing, and I include myself, our family were farmers. You know, we rain. The general public has no idea what you deal with day to day. You have to be a weather forecaster, you have to be a mechanic, you have to be all of the above. So one of the things that I would suggest that we do is a job description for a farmer, so we could educate our general public of what it takes to be a farmer out there. I mean, it's not an easy task. Now, the flip side of that is every time you see two farmers sitting together talking, it's like two good old boys because they can relate the culture of everything. And I was once told somebody, we did an interview with Secretary Redding, and it was like two good old boys on the farm having a conversation. So we want to thank you for bringing this to the attention of all of us. And we have a lot of work ahead of us to do to kind of address the problem out there. For so long, we've just kind of kept it, if you will, within the family. So I just wanted to say thank you for being here. Thank you, chairmans, for being here and the committee for bringing this to the forefront. Thank you very much.
Thank you. Could I say one quick thing about that? And that is that the general public really has no idea what's happening. They have no idea of the job description, but they have also no idea of the decline in agriculture. And I say it like this. When we had the farm crisis in the late 70s and early 80s and a lot of farms were being foreclosed on, that was national news. Everybody knew there was a farm crisis. These days, it seems to me we don't have so much of a foreclosure crisis as we just have a closure crisis. You know, I kept my farm. We just closed our enterprise. And when the average person takes a drive out into the countryside and they see a barn and the silos, they have no idea that that guy went out of business. So, yeah, absolutely.
Representative Kincaid.
Thank you, Chairman. So before I was a legislator, I was a lawyer, and similar to farmers, lawyers have a dramatically increased rate of substance use disorder, anxiety, depression, and suicide as compared to the general public. And so I always find it very important to tell people that I take antidepressants, that I have depression, and that I seek therapy, and that there is no shame in that. And so I think that is, Jeff, to your point, something that matters to people when they hear it, when they hear somebody who is in a position similar to them, and they're like, oh, this person sought help and is able to kind of talk about it, and there's not that stigma and that shame. I think that really breaks down essential barriers that and I appreciate all the work that you guys are doing to be able to do that, because I think that is the biggest issue to overcome, is to let people know that they can seek this assistance and there's no shame in it. I am one of the 73% that lives in those 19 counties. I'm from Allegheny County. I live in the city of Pittsburgh, but I am the vice chair of the House Ag Committee because there's 62,000 people in my district who eat. And so I've gotten really involved with urban agriculture. And one of the things that I have noticed is that we sort of speak in silos a little bit, where, urban ag folks talk to urban ag folks and traditional ag folks talk to traditional ag folks. And there's a lot of important information that both of those groups have to help each other. And I think when we talk about reducing stress and trying to help folks to be able to keep things going, I think our urban ag folks are producing maximally on a quarter acre of land. And our traditional ag folks have been doing this for generations, and they know how to do stuff, how to start stuff up. And so you don't have to reinvent the wheel because you already know how to do a lot of this stuff. Are there systems in place, or could we help to establish systems to do a little bit more of this, like, sort of cultural exchange, if you will? Because I see an opportunity to help address the stress issue of production, of keeping things going by, taking ideas from either group and exchanging them so that people don't feel like they're alone. People don't feel like they have to come up with a way to do things that other people are already doing. Are you guys working on that, or do you see a benefit in that possibility?
I'd like to address that. Being a Farm Bureau, I'm also actually on the national level too. We do interject, and we know that our urban farming is very, very important and is growing very fast. So we've had them come and do talks with us. We're trying to come together as one. And I myself, in the state of Pennsylvania, have traveled over here to the eastern side, because I'm from the western side, attended an urban agricultural event. And it is very important because there is a lot going on in Philadelphia that people don't realize, in Harrisburg, more so, and like in Pittsburgh too, we know. So we're trying to partner together with the urban agriculture. Maybe it's not happening as fast as I'd like to see it, but we are reaching out because we know it's important for us to work together to be able to survive, because we're all dealing with the same stressors. So that's what we're trying to do with Farm Bureau.
I think, Representative Kincaid, I'd like to say that we also see those divisions in rural areas. I was doing research on childcare in agriculture and how it connects with safety. And I was talking to farmers with a lot of different states, and because of the practicality, it was during COVID-19, we were doing them on Zoom. We had farmers from Vermont, Wisconsin, and Ohio on the same call. Those were mostly old rural folks, but producing very different types of agriculture. Hemp production in Vermont on 1/4 acres, 2,000 dairy farm in Wisconsin, 2,000 row crop in Ohio. And what was fascinating is at some point, one of the women said, what I'm realizing is we spend a lot of time thinking that we are different, but in reality, we're very similar and have the same struggles. And I think we often do the us versus them because it's easier. So I think, yes, I think any time that we can recognize that a lot of the challenges that folks are not so different, in particular when they come to household level challenges. Health insurance is a unifying challenge. When I do my research, no matter how I look at the data, by scale, by where people live, it's a challenge. So anything that can be done to build bridges, I think is really important, and to recognize that it is mental health challenges is a unifying issue, and it's also where you'll find a lot of people coming together and say, yes, let's work together.
One last question. Representative Krupa.
Thank you. And I do apologize. It's more of a comment than a question, so I'll try to keep it brief because I know that we're over. But a lot of the questions that I had have been answered. But I want to thank all the presenters. This is such an important issue. And frankly, this is something I feel like this conversation could go on for days, not just hours. But I am from a farming family in Fayette County. So thank you to my neighbors from the Southwest. It's good to see the Southwest well represented here today. My husband came from a farming family. I came from a farming family. Farming is so much, often it's part of our heritage. It's part of our identity. And so it's not just leaving a career choice or a path, but I was so happy, Doctor, particularly with your comments with policy issues. And I guess anybody, not just farmers, would follow in this boat. We don't want mental health help. We want policies set in place that are going to support us before we get to that point. And when you look and serving on this committee, there are so many ways that the small farmers across Pennsylvania and across the nation that government is getting in their way. It's more red tape, it's more regulation, and we need to take a step back. When your local farmers can't sell fresh meat or milk to their neighbors, we have an issue. I do have to say on the side issue about childcare, part of the thing that farmers love is the opportunity to spend time with their children, and safety always has to be first. I remember when I was 18, I picked up my older brother's thumb off the ground during a farming accident in the summertime when we were making hay. So I mean, there are the physical hazards of farming. There is the economic issues, and so often operating in the red tape. But farmers are drawn to that lifestyle because it's a simpler, healthier, physically in terms of the food you eat, the exercise that you get, but it's a humble life, and it's one that we cherish. So I appreciate everybody here, and I look forward to continuing this conversation, and I promised I'd keep it brief, so thank you for being here.
Thank you. I want to thank all our presenters for being here today. Always, this is like a conversation that could go on for days. I could ask questions for a couple hours myself, but I won't. I appreciate everybody being here. Thank everyone in the audience for being here. Thank all the legislators for being here, obviously. And one thing I gained out of this the most, I guess, is eat more chocolate. Thank you very much. Enjoy the farm show. Have a milkshake. Thank you.